I am a cardiologist, and I need you to stop everything right now. Because what I am about to tell you, most doctors never say out loud. Not because it isn't true, because it is uncomfortable. Because it forces people to face something they would rather push aside and ignore. But ignoring it is exactly what is killing people over 70 every single day. Here is the truth nobody tells you. Most heart attacks in adults over 70 do not feel like heart attacks. They feel like tiredness, like indigestion, like a sore back, like an arm that aches from sleeping wrong. And while the person is reaching for an antacid or lying down to rest, the clock is running. Heart muscle is dying, permanently, irreversibly. Every single minute without treatment is damage that never heals. I have stood in hospital corridors and delivered that news to families. I have watched a wife's face change when I tell her, he could have survived this fully if he had come in 2 hours earlier. 2 hours. That is the difference between a full recovery and permanent heart damage. Between going home in 3 days and never going home at all. After 30 years of cardiology, I am done watching people miss the signs that could have saved them. So right now, I am going to give you all 7, exactly what they feel like, exactly why they happen inside your body, and why each one is so dangerously easy to dismiss. Pay attention. This video could be the most important thing you watch this year. Warning sign 1. Unusual, unexplained fatigue. This is the most missed warning sign in adults over 70, especially in women. And it is the one that breaks my heart the most, because it is dismissed every single time as simply getting older. I am not talking about normal tiredness after a long day or a poor night of sleep. I am talking about a fatigue that arrives from nowhere and refuses to lift no matter how much you rest. A heaviness so deep that walking to another room feels like climbing a mountain. Making breakfast feels like an achievement. Climbing one single flight of stairs leaves you needing to sit down. A tiredness that feels fundamentally different from anything you have experienced before, like your body is running on almost nothing. This happens for a precise medical reason. When the coronary arteries are narrowed or partially blocked, the heart must work significantly harder to push blood through. That extra demand drains the body's oxygen supply. The muscles, the organs, the brain, all receiving less than they need. And the body communicates that oxygen deficiency through one overwhelming signal: profound, crushing, unexplained exhaustion. The dangerous part is how easy this is to rationalize. You tell yourself you didn't sleep well. You tell yourself you've been doing too much. You tell yourself this is simply what 70 feels like. And every hour you spend rationalizing is an hour the heart is sending you a signal you are not answering. If you feel this kind of fatigue that arrived without a clear reason, that feels different from your normal tiredness, that does not lift with rest, do not dismiss it. Do not wait until your next scheduled appointment. Call your doctor today and use these exact words: unusual fatigue that doesn't improve with rest. Those words change how a physician responds. They matter. Warning sign 2. Chest discomfort that is not pain. Stop waiting for chest pain. In adults over 70, chest pain is frequently absent during a cardiac event. And that absence is one of the most dangerous realities in cardiology, because people wait for a pain that never comes, while the real symptom sits right in front of them, completely ignored. What you may feel instead is pressure, tightness, a sensation of fullness or squeezing in the center of your chest, as if someone placed a heavy weight directly on your sternum and left it there. Sometimes it lasts only a few minutes before fading. Sometimes it comes and goes across several hours. Sometimes it feels so convincingly like indigestion that you reach for an antacid without a second thought. Do not reach for an antacid. Here is what is happening beneath that sensation. The heart muscle, starved of oxygen through a blocked or severely narrowed artery, sends distress signals through the cardiac nerve pathways. In a younger person, those signals arrive as sharp, unmistakable pain. In a body over 70, where those nerve pathways have lost some of their sensitivity with age, the same distress arrives muffled, dulled, as pressure instead of pain, as tightness instead of agony. The signal is identical, only the volume has changed. And because the volume is lower, people wait. Any unfamiliar sensation of pressure, tightness, squeezing, or fullness in the chest, however mild it seems, however briefly it lasts, is a cardiac symptom until a doctor tells you otherwise. Not something to monitor through the night. Not something to mention casually at your next checkup. Something to act on immediately. Warning sign 3. Discomfort in the jaw, neck, or back. This is the warning sign that confuses people most, because it has absolutely nothing to do with the chest. And yet it is one of the most consistent pre-heart attack symptoms I see in patients over 70, particularly in women. And it is the one that sends people to entirely the wrong place at exactly the wrong time. Here is the medical reason this happens. The nerve pathways that carry distress signals from the heart share overlapping roots with the nerves that serve the jaw, the neck, the upper back, and the space between the shoulder blades. When the heart sends a distress signal through these shared pathways, the brain, unable to distinguish which organ the signal originated from, sometimes localizes the sensation in the jaw or the back instead of the chest. The result is a person experiencing active cardiac distress who feels it entirely in their jaw, who feels a strange aching pressure between their shoulder blades, who feels a persistent unexplained tension running up the back of their neck. So they visit their dentist. They take ibuprofen for what feels like a pulled muscle. They apply a heating pad to their back and lie down to wait it out. And while they wait, the heart is in crisis. What makes this sign particularly dangerous is that it almost never arrives dramatically. It tends to be a dull, persistent discomfort, an ache that doesn't belong, a tension that wasn't there yesterday and has no clear explanation today. Mild enough to ignore, easy enough to explain away. Do not explain it away. If you experience unexplained discomfort in your jaw, your neck, your upper back, or between your shoulder blades, particularly when it appears alongside any other symptom in this video, treat it as cardiac until a doctor tells you otherwise. Not tomorrow, today. Warning sign 4, shortness of breath without exertion. There is a specific type of breathlessness that I need you to understand because it is one of the clearest cardiac warning signals the body can produce, and it is consistently misread as a lung problem, a fitness problem, or simply age. If you find yourself becoming breathless during activities that never used to affect your breathing at all, walking across a room, climbing a single step, standing up from a seated position, that is a warning worth taking seriously. But if you are becoming breathless while sitting completely still, while resting quietly, or while lying flat in bed at night, that is an emergency signal. Here is exactly what is happening inside the body when this occurs. When the heart is struggling to pump blood efficiently because an artery is narrowed, because the cardiac muscle is under stress, blood begins to back up into the pulmonary system. Fluid accumulates in and around the lungs. The lungs, now partially congested, cannot expand fully with each breath. The experience from the inside is an inability to take a fully satisfying breath, a feeling that no matter how deeply you inhale, something remains incomplete, a sense of air hunger that rest does not resolve. Some patients describe waking in the night unable to breathe comfortably lying flat, and finding that sitting upright in bed brings partial relief. That nighttime breathlessness, that need to sit upright to breathe, is a symptom I take with absolute seriousness every single time a patient describes it. It tells me the heart is struggling with fluid management. And a heart that is struggling with fluid management in the night is a heart that is sending you one of its loudest available warnings. This symptom is never normal. It is never simply being out of shape. It is never aging. Do not accept those explanations. Demand a cardiac evaluation. Warning sign 5, nausea, indigestion, or stomach pain. This is the warning sign that sends people to the wrong place at exactly the wrong time, and it may be the most underappreciated connection in all of cardiac medicine. A heart attack can produce nausea, vomiting, or a feeling of stomach upset so completely convincing, so indistinguishable from ordinary indigestion, that patients spend hours treating their digestive system while a cardiac crisis unfolds unaddressed. I have seen this happen, more times than I want to count. A person who believed they had food poisoning, a person who took antacids every hour through an afternoon, a person who finally came to the emergency room not because they suspected their heart, but because the nausea simply would not stop. The reason this happens is precise. The vagus nerve, one of the most important nerves in the body, runs in direct proximity to the heart. When the heart is under severe stress, the vagus nerve transmits that distress in a way the digestive system receives and reacts to. The stomach responds. Nausea follows, sometimes vomiting, sometimes a deep, cramping abdominal discomfort that feels entirely digestive in origin. It is not digestive in origin. It is cardiac. If you experience sudden, unexplained nausea or stomach discomfort, especially when it arrives without an obvious dietary cause, especially when it appears alongside unusual fatigue, any chest sensation, or difficulty breathing. Do not treat it as a stomach problem and wait. The cost of that assumption in cardiac medicine is a cost measured in heart muscle, in minutes, in outcomes that cannot be reversed. Warning sign 6. Pain or heaviness in the left arm. This is perhaps the most classically recognized cardiac warning sign in medicine, and it is still missed, consistently. In adults over 70, because it almost never arrives the way people expect it to. People expect sharp pain. They expect something dramatic and unmistakable that stops them in their tracks and announces itself clearly as something wrong. What they get instead, in a body over 70, is a dull, heavy ache. A persistent heaviness that begins in the shoulder and travels slowly down through the arm, sometimes reaching the elbow, sometimes continuing to the wrist, sometimes settling in the hand as a strange numbness or tingling that doesn't belong. It feels exactly like a muscle ache from overexertion, exactly like the kind of soreness you might feel after carrying something heavy, except that you haven't carried anything, you haven't overexerted. The arm simply began to ache, quietly, persistently, and you cannot explain why. The mechanism behind this symptom is the same as the jaw and back discomfort I described earlier. The nerve pathways from the heart share roots with the nerves serving the left shoulder and arm. Cardiac distress travels those shared pathways, and the brain, unable to pinpoint the true origin, registers the sensation in the arm. This symptom alone deserves medical attention. But when it appears together with any other sign in this video, with unusual fatigue, with chest pressure, with breathlessness, with nausea, the picture becomes urgent. At that point, you are not calling your doctor's office and leaving a message. You are calling emergency services immediately. Because when 2 or more of these signs appear simultaneously, the probability of an active cardiac event is not something to take chances with. Not for a single minute. Warning sign 7. A feeling that something is simply wrong. I want to spend more time on this one than any other, because this is the warning sign that the medical system tends to undervalue, and that I have come to treat with more clinical seriousness than almost any other symptom a patient can describe. In 30 years of cardiology, I have reviewed thousands of cases. I have read the records of patients who survived heart attacks and studied the accounts of families who lost someone to one. And across all of those cases, across all of those different people with all of those different symptoms, one thing appears with striking, almost haunting consistency. Before the cardiac event, the person felt something they could not name. Not a specific pain, not a localized sensation they could point to on a diagram. Something deeper than that. A profound, unsettling internal sense that something in their body had shifted, that something was not right, that something was happening beneath the surface that they could not see or measure or fully articulate, but that they could not dismiss either, no matter how hard they tried. Patients who survive describe it as a feeling of impending doom, as a quiet alarm going off somewhere inside them that had no off switch, as a certainty, irrational, unexplainable, but completely unshakable, that something was seriously wrong. The families of those who did not survive say the same thing. He told me that morning he just didn't feel right. She said something felt off, but she couldn't explain it. He seemed unsettled all day, but couldn't say why. They felt it. They knew something was happening. And they waited, because they couldn't prove it, because they didn't want to cause alarm, because what they were feeling didn't match what they believed a heart attack was supposed to feel like. I need you to understand something fundamental about that feeling. The body is not being irrational when it generates it. It is being precise. The physiological changes that occur during cardiac distress, the shifts in blood pressure, in oxygen delivery, in nerve signaling, are real and measurable. And the nervous system detects them before the conscious mind can identify them. That feeling of something being wrong is the nervous system communicating what it already knows. Trust it, completely, without reservation. You do not need a diagnosis to call for help. You do not need to be certain. You do not need to be able to explain exactly what you are feeling. You need only to say, "Something feels wrong and I cannot explain it." Say those words to emergency services. Say them to a family member. Say them to anyone who can get you to medical help immediately. The embarrassment of a false alarm lasts one afternoon and is forgotten by morning. The consequence of ignoring that feeling, of waiting to see if it passes, of convincing yourself it is probably nothing, can be a consequence that lasts the rest of your life. Or ends it. I have given you all 7 warning signs today. Every one of them is real. Every one of them has been present, in patients who survived and in patients who did not, before a cardiac event that changed or ended their life. The difference between those two outcomes is almost never the severity of the heart attack. It is almost always the speed of the response. The people who walked out of my hospital with full recoveries, who sat in my office 6 months later looking better than before, were not the people who had the mildest events. They were the people who acted the moment something felt wrong, who did not wait, who did not rationalize, who trusted their body and made the call. I want you to be one of those people. Write these 7 signs down. Put that paper somewhere you will see it every single day, and share this video with every person over 70 in your life, because the person who needs this information most may be someone who would never find it on their own. That share takes 10 seconds. It could save their life. Leave a comment below with your age and where you are watching from. Tell me, did you know all 7 of these signs before today? Was any one of them a surprise? Subscribe if you haven't already. Like this video, because everything on this channel exists for one reason: to give you the medical truth that protects you and the people you love. Your heart has worked every second of your life without a single day off. It is time to start paying attention when it speaks.